Good afternoon, everybody. Thank you for coming, and thank you for gathering outside. And we're all putting some distance between ourselves, as always now. But it's good to be with you. I wanted to update everybody on a few things. First of all, I wanted to announce that the city of Hartford will be, as of tomorrow, imposing a more restrictive ban on social and recreational gatherings. The statewide ban stands at 50. In the city of Hartford, we are reducing that number down to 10 and prohibiting any social and recreational gatherings of more than 10 people. We're taking this step for a number of reasons. First of all, CDC guidance is now that events or gatherings of more than 10 should be canceled, and we want to reflect that CDC guidance in our own local policies. Secondly, we just really want to emphasize for folks the importance of staying away from large groups. We want to make sure that people assess any gathering that they're in and really ask whether it's necessary and avoid large crowds. We don't intend to have our police officers out there looking to arrest anybody. But as the weather gets warmer, if we start to see large groups gathering, we may ask people to disperse. We will ask people to disperse. So I ask that people take this seriously, and I'm happy to answer any questions about that in a few minutes. I also just want to say that this is a measure. We've been in touch with a number of cities and towns around the state, and this is a measure that I believe a number of other municipalities are considering or are implementing today or in the very near future. Secondly, I wanted to just let everybody know, I think that you've all now received this through a press release, but I wanted to let everybody know that we have had 4 members of the Hartford Police Department test positive for the new coronavirus. I want to stress, though, that these individuals have not been in the office, have not been at work or reporting for duty for quite a while. These members of the police department on personal time had traveled to Spain before there was any CDC guidance against that travel. They actually returned before Spain was included on the CDC advisories. But nonetheless, despite the fact that Spain had not yet been included on the CDC advisories, we instructed those officers not to report for duty for 14 days, and we're very glad that we did. Those 4 officers have all tested positive, and the fact that they have not reported for duty since coming back likely minimized a number of potential exposures within our police department. Those police officers so far, thank goodness, are not showing any significant symptoms. They are all in quarantine at home, and we are taking every measure that we can to make sure that our entire community stays healthy, that our first responders stay healthy, that our essential employees who are reporting to work stay healthy, and that our healthcare employees stay healthy. And I say that both just to be transparent and share that information, and also to emphasize a couple of points. One, this is an instance where the measures that we took as a city went above and beyond what was legally required, and even went above and beyond what we saw in the official public health guidance. But we're very glad that we took those measures and that we acted with additional caution. The second thing is just to note that these officers I think I can say that these officers have, for the most part, been asymptomatic. And the reason I stress that is I think we really all have to recognize that the number of confirmed positive cases is likely the tip of the iceberg, and that people can be asymptomatic with the coronavirus for a long period of time. And that's why we think it's so important to keep reinforcing this message of social distancing, that we all have to work together right now to slow down the spread of this virus, to spread out that peak, to flatten the curve. And the way that we work together right now is by staying apart, which again is one of the reasons we're taking this additional measure today of reducing the limit of gatherings down to no more than 10 people. A few other updates before I open it up for questions. First of all, one of our top priorities right now is working hand in hand with our hospitals to identify potential sites that can be used as hospital annexes or where additional bed capacity can be found in the event that we have a major spike in cases or patients at our hospitals who can be treated or cared for off-site. So we are working hand in hand with our hospitals, our health team, our fire marshal's office, and hospital facilities folks are working together to identify those locations now. As I think I mentioned the other day, we're also working very hard to put in place measures to ensure that we're protecting our homeless community. This is one of the points of vulnerability, just being very direct about it, that concerns me and concerns our team the most, because we have shelters where we have large numbers of our homeless population in one place, and we have to strike the right balance of trying to disperse that homeless population, but at the same time make sure that there's adequate skilled staffing to provide the supports that community needs. So we're working hard as a team to try to address that and to put a couple other measures in place. There's many other things that I could talk about, but I want to say a couple of things before opening it up. One, I just want to say thank you to the state. Governor Lamont and his team have been extraordinary partners. They have been very communicative. We've been in constant contact, both myself with the governor's office and the COO, Josh Jabal, as well as members of our team with their counterparts of the state, and I'm grateful for their response. It was already announced today, but I just want to use this as a chance to amplify the message that the governor is also closing down barbershops and nail salons. Important just to pass that along, and I think a lot of public health experts had concerns about those facilities because those are facilities where folks can be in very close contact for an extended period of time. So support the governor's decision on that as well. With that, I'm happy to take any questions, and again, thank you all for being here.
If they were asymptomatic, what prompted them to be tested?
So the reason that we kept them out of work and said please do not report to duty is because they had traveled abroad, and at that time Spain was not on the list. As you've seen, the number of cases in Spain has escalated rapidly, just as it has in every country that has experienced this trend, this curve now. And because the number of cases in Spain, as well as because they are first responders, and we want to be extra careful that we are protecting our first responders and not exposing those departments, which we have to keep operational. We've got to keep functional and up and running. That's what led to them being tested.
And then also the beds, you're looking for, do you have places in mind?
We do. I'm not going to identify specific places until they've actually been announced. There are a lot of considerations that go into that. One, you want a place that has adequate scale, so you don't want to have many facilities dispersed around the city. You also want to have places that have the ability to do on-site food preparation. You want to have facilities that have the ability to isolate, some patients from one another in the event that you have some who are just being monitored and others who have tested positive. So that's why we're working hand in hand with the hospitals and with their facilities teams. And when we have sites identified, we'll obviously make those public.
In talking with the healthcare, do you feel there's enough personnel to staff those? I mean, finding rooms and staff, that's not necessarily your job, right?
Well, I was talking with leaders of our hospitals today about that. That's obviously something that they are prioritizing. It's not something that we can, from the city, help with, but where we can help, we're working to do that, and I think where we can help is on the physical facility side.
Do you want to see the governor put out a shelter-in-place?
So the question, for those if you can't hear it, was do we want to see the state impose a shelter-in-place order? What I would say right now is I think the guidance from the state, from the CDC, and from the city, as well as from towns across the state, has been pretty clear, which is if you don't have to leave home, don't leave home. Shelter in place can mean a lot of different things to a lot of different people, but I just want to stress this message that if you don't need to be out and about, and if you especially don't need to be out and around groups of other people, please don't. Please stay home. And I ask everybody to take seriously their responsibility because as we always say at these events right now, press conferences, it is true that for the vast majority of people who get this virus, it's not really any different from getting a cold or a flu. But for some members of our community, it can be very severe and it can be fatal. And as we've seen, Connecticut has already seen 2 lives lost. So we ask everybody to take this guidance and these measures very seriously to protect your own health and to protect the health of those who may be more vulnerable than you.
New Britain has put in a curfew, and also West Hartford strongly recommending that anybody under school age, high school age, be in by 8. Do you think a curfew should be in place?
We are recommending that everybody be at home unless they don't need to be at home. Unless they need to not be at home. But look, I will say this. We're not trying to keep people from getting out and going for a walk or getting out and going for a run. Those are things that actually can contribute to health, not threaten health. We want you to do that by yourself or, with your small immediate family. We don't want you bringing big groups of people together. But this is not a situation where this is going to be a prolonged situation where these restrictions are in place for a long, long time. And I think the measures have to be focused on reducing the opportunities for the virus to be transmitted more quickly in big groups of people. And that's what we're focusing our efforts on.
Do you expect to see other cities and towns start banning gatherings of 10 or more people?
As I've said, we've been in touch with a number of communities, some of the bigger cities across the state and some smaller communities around Hartford and elsewhere in the state. And I think there are a number of communities that are actively considering or are, in fact, implementing similar measures today.
How's the school meal distribution going?
So the question was about the school meal distribution. As I said the last time, we are constantly adjusting. We've seen the numbers of meals distributed increase pretty significantly each day, but we are looking at ways to expand and modify that. I don't have an announcement for you today, but the superintendent and I and our teams have been working together, and I think we will be making some changes to the way that works. So stay tuned, and we'll do our best to get all that information out there in detail.
You guys already started considering alternate locations for hospitals?
Yeah, so that's what I was referring to before. Working hand in hand with the hospitals to identify those other locations or annexes.
Can we ask Chief Tony a question?
Sure. Yep.
From a public safety standpoint, I read that gun sales are up across the country. I think the Times did an article about domestic violence. A lot of couples who are spending more time together that probably shouldn't be. Are you concerned for public safety at all?
So the domestic violence part of it, as you know, we have a domestic violence counselor embedded in the police department, and we've been actively communicating with them. There is more of a potential for domestic violence as people are sheltered in place. Our officers are prepared to respond to those. We have not at this point seen an uptick in that. As far as the gun sales go, I think we've seen that before. We just encourage people to make sure that they're stored properly and that they don't get into the wrong hands.
Here's a question for you, Chief.
Yes. Yeah, so one of the services that we're not providing is fingerprinting and permitting services. So there's not any new pistol permits going through the process at this point.
Can you give a time frame when the officer quarantine, when they could be well enough to return to the job? I don't know if that...
Yeah, I don't know. I mean, so the quarantine that we originally put in place was the 14-day quarantine that was recommended. Now that we have some that have tested positive, we'll make sure that they don't come back to work. As the mayor said, we did that out of an abundance of caution. We want to make sure that we have a well-staffed, healthy police department, and so we're taking measures that may be above and beyond just to make sure that we keep that department healthy. Those officers won't be returning to work until we're sure that any threat of exposure is over.
Are any other officers being tested or no?
One additional that I know of that may have had exposure to one of those officers before they tested positive is at home and undergoing tests now.
But I know that it's maybe just repeating something that's been said a lot of times, but I do think we can't stress enough that the confirmed positive cases represent just a fraction of the number of people out in our community and around the state who have the new coronavirus. This is out there. It's spreading in the community, and that's why it's so important for us to take the measures that we can and for everybody to do the things that you can to limit your contact with other people, to take those basic precautions of washing your hands a lot and washing them well, of not shaking hands, not touching your face, staying away from big groups of people. Again, there really is a role for all of us to play, and it's important that everybody take that seriously. And I think that we're likely to see a very rapid acceleration of the number of positive cases, confirmed positive cases. And in some ways, that simply reflects the additional testing capacity that's out there right now. At Hartford Hospital and at St. Francis, there are drive-through testing sites up and running. I do want to emphasize for everybody that you can't just show up at those sites and ask to get tested. You have to have doctor's orders. You have to have a prescription. So please don't just drive up there and expect to be tested. But if you have symptoms that concern you, or if you have exposures that concern you, then reach out to your own healthcare provider, reach out to your doctor, or reach out to the hotline that Hartford Hospital set up. That's 860-972-8100, 860-972-8100. And if you have doctor's orders, or if you get a prescription to get a test, you'll be able to do that at a drive-through testing site.
Were police officers in touch with any other police officers outside of work?
Well, there was one that the chief just mentioned.
But nobody else like this?
None that we know
fire
of.
Department? I know it's a big family.
Yeah, none that we know of, and we also have confirmed that none of our firefighters have traveled internationally recently.
I have one last question about
Sure.
the schools.
Yeah.
Some other communities have done surveys to figure out how many students are without devices or internet access. So far, the Hartford School District hasn't done one of those. Do you know what the plan is?
I do know that this is something that the superintendent is very focused on. Don't have any announcements to make right now, but as we're all preparing for a possibly long disruption and long period out of school, the Hartford Public Schools is working hard on figuring how to help with potentially moving towards remote learning and getting devices out there. But there's a lot of work that needs to be done to make that possible.
Do you anticipate that being a large number of families?
Yes. Any other questions? Okay, well, I want to thank everybody for being here, and we will continue to provide updates as we have information to share, but as always, please don't hesitate to reach out to our office if we can answer any questions that you might have in the meantime. Thanks so much, everybody.